Okay. Hi, good morning, everybody. I'm Alan Rippin, the Director of the Center for Active Living at the Council on Aging, and thank you so much to our wonderful interns who've put together this presentation today. I've got Katie and Cameron, and Jack will be joining us shortly about some of the resources available through ACCA and the community. So I'm just going to hand it over to you, Katie, to get started. Thanks again.
All right, sounds good. Well, hi everyone. Thanks for joining today. I'm so glad that we had a pretty good turnout of everyone. So we, as the summer interns, really wanted to put together a project that joined us all together, that we could work together and kind of show all of the resources that we have through ACCA, but also the Athens community, because there really are so many. And we as undergrads, we all went to the University of Georgia and majored in health promotion, really realized that there are so many resources that we did not know about until we learned about them in our classes. So that was kind of our inspiration behind wanting to put together this presentation, just so all of our members were aware of the services that ACCA has for everyone, as well as some that are in the Athens community. So it's me, my name is Katie. I am the Center for Active Living intern, and we also have Cameron.
Hey, I'm Cameron, and I'm the Grandparents Raising Grandchildren intern for this summer.
And we also have Jack Reynolds, who is the Meals on Wheels intern, and he's actually making a route run right now. So hopefully he'll be able to join us soon. So we're going to save his portion for last. So sorry if we're bouncing around a little bit on the PowerPoint, but we really want him to be able to join us and share what he has to say. So Cameron, are you ready to present?
Yeah, sure.
Okay. So we have three different topics that we really wanted to speak about, and these are just the three different main areas of resources that we have seen available through ACCA as well as the community. So first we have our health resources. We also have our food resources, which I will be presenting on, and social resources that Cameron will be presenting on. And the health resources obviously are Jack's. So we're going to skip through that real quick and come back, and we'll start with food resources. So we have a lot of programs that are offered through ACCA. As many of you know, right now we are also doing, through the Center for Active Living, we're doing meal and commodity bag deliveries, which have been really awesome. And Alan knows more of the statistics about those, but we have been serving a wide variety of people, and it's been really cool. So there's that, but also the main ones that have been continuing throughout ACCA have been Meals on Wheels, the Lunch Buddy program, as well as the Athens Senior Hunger Coalition. So Meals on Wheels, as many of you I'm sure are aware, it's somebody comes to your house daily on weekdays and drops off either frozen or fresh meals, fresh during the week and frozen for the weekends if you prefer that. And they're really focused on trying to be nutritious and trying to get everybody that they're serving having a balanced diet, which is a great program that they have going on at Meals on Wheels. The Lunch Buddy program is really focused on trying to connect seniors who are at home and by themselves with people outside in the community to help socialization. I don't know too much about it because I don't think we're doing that right now, but you can have a volunteer and they'll join with you and have a lunch once a week. It seems like a really great program that everybody can get involved with. And then the Athens Senior Hunger Coalition is just a project and a group, again, that aims to decrease food insecurity amongst seniors in the community, which is fantastic. So these are all programs that have been offered through ACCA. There are also a couple of programs within the Athens community. I believe that Campus Kitchen has partnered with ACCA, yes. So that's a really cool connection to be able to connect the University of Georgia and the students there, and partner with them and ACCA to get them more involved with the community. That's more of the lasting community in Athens, and get them connected with older adults in the Athens community. So they will recover and redistribute food that's coming from grocery stores, from farmers and stuff like that. And they take it, and volunteers will actually cook meals at the campus kitchen location and drop them off. I have a few friends who have volunteered with them, and it's a really great program, and they all really, really like it. We also have the Food Bank of Northeast Georgia, which has the Senior Brown Bag program, which aims to distribute supplemental bags of food once a month to seniors that may be in the food insecure category. And there's also the Senior Mobile Pantry that works to distribute the bulk food that goes directly to seniors at local senior centers. So comes to places like ACCA or other senior centers in the area. And you can get in contact with the Senior Brown Bag program by going on the Food Bank of Northeast Georgia website. Oops. Okay. All right.
I might just jump in real quick, Cameron, before you get started. Thanks, Katie. Just to follow up on, let me just do my video again. I do have some numbers on how many people we've served. So we have some statistics on our website right now, but it looks like the latest is 1,795 total people served. And then 87,785 total meals served. So that's incredible. That's quite a bit. And I think we've even done over 4,000 calls to people, safety checks and buddy calls. So we're really calling people every week, and serving well over 1,500, almost 1,700 clients total since March. So, you know, it is a team effort. Like you were saying, it's our programs, it's the food bank, it's Campus Kitchen, all these places sort of coming together and making this happen. So we're very proud of the work we've been able to do, and reaching so many people in need, and satisfying that need. So yeah, thanks for that information. But yeah, those are some numbers to go with it.
That's awesome. Yeah, thank you so much, Alan. All righty, and we'll move on to social resources with Cameron.
Yeah, so I'm doing social resources, and I wanted to bring up some resources that ACCA themselves offer. And so honestly, Katie and Alan could tell you more about the Center of Active Living and the virtual calendar that you see listed here. But we also do Adult Day Health and the Senior Community Service Employment Program, which is a great opportunity for our older adults to get active within the community, although during this pandemic and this time, it's definitely been put on the back burner. But once things get going back up again, it would be definitely a great way to get out and serve your community and that kind of thing. And then, so yeah, if Katie or Alan, if you want to add anything about the Center for Active Living or the virtual calendar, y'all know about that more than I do. And I don't want to get any information wrong there.
Yeah.
Go ahead, Alan.
Oh, sorry. No, Katie, you go first. You're so.
I've been working with Alan for the Center of Active Living as their intern. And again, things look really drastically different than if we were in person. But we've really been working to try and have our activity packets that we've been sending out, which have been great. We've been doing a lot of Zoom activities. We have our weekly Tuesday Zoom meeting, which has been really awesome. For me personally, I've been really enjoying to get to know a lot of our members and stuff like that. And we've also been doing the safety checks, which I think other programs are doing as well. But for right now, that's kind of what my role in the Center for Active Living is.
Yeah, and I think you all and the staff too have really adapted really well to the change. I mean, yeah, our services and programs look very different than they did a few months ago, but thank goodness for technology to help us out, to extend some of these offerings virtually. And we recognize that technology is a challenge for a lot of people still. We're available to help people one-on-one, even if they have questions about how to use the Zoom, how to the technologies that may keep them from participating. So we know that's a barrier for some, and hopefully we can help. That can be another service we provide for people to help them get comfortable with that. So yeah, like you said, we've got lots of fun Zoom offerings. I know a couple people on the call have joined in. I know Paula was on my cooking class that I did. Alan's been on our weekly social calls. So, we're always open to ideas and what the community would like as well. But we're having fun with it, and having to be flexible and adapt to changing conditions constantly. But I feel like we're doing a good job with that. And Nikayla, I know you're on the phone. I don't want to put you on the spot, but if you want to add anything about our program at the Center for Active Living, I know you've done quite a few virtual trips and things.
Yes, just adding on to what Alan is saying, we are constantly just trying to continue with an engaging and fun calendar. So we're always open to suggestions from our members. And I have been doing some one-on-one sessions for Zoom and smartphones and things because we want everybody to be caught up to speed. We don't want anybody to get left behind during this time of separation. So just know that we're all here for the community, for our clients and members.
Yeah, well said. And I know Adult Day Health as well, and we're going to start doing this, is some driveway visits. So coming in person, I know just there's nothing that can replace the in-person contact with people and saying hello. Even though we can't hug each other, we can still wave and share the latest news. So, we're organizing that. And I know Adult Day Health, those staff members and aides have been going to people's homes at a safe distance and just paying a visit and brightening up their day. So, we're looking at doing more of that as well. But yeah, so that's our news from us.
Fantastic. All right, we'll go ahead and...
Yeah, okay, so these are some local resources outside of ACCA that I thought would be really helpful. And these next ones are more like financial assistance and that kind of thing. So the first one is the Social Security Administration. And while their offices are still closed indefinitely at this point, you can call them, but mostly they want you to use their online services. And if you need to call them, you can, but it is asked by them that you try to do their online stuff first. And but anyway, you can do a good bit of things on their online portal. You can apply for retirement, disability, Medicare, those things, as well as you can kind of check your applications for those things, like retirement and disability, and see where they are. Or if you made an appeal for any of those things, you can check that there. You can also request a replacement Social Security card, and it could be sent to you through the mail. In addition to printing a benefit of verification letter. And you can also just, depending, you can get on a portal and you can give your Social Security number and it'll sign you in. And you can see some of the statuses of your other aid statuses and that kind of thing. So they're a good resource. I recommend that. And then again, they have that hotline phone number ready for you on their website if you need it and need assistance guiding that. The next one I have is Georgia Cares, which is actually a federally funded program, and it's administered by the Georgia Department of Human Services and specifically the Division of Aging Services. And they just basically help you guide you on your Medicare plans and that kind of thing. So they can help you understand your health plan choices. They can help you enroll you. They can review your Medicare summary notices. They can explain those to you. And they can help you sort through your medical bills and that kind of thing. And they can help you apply for federal assistance. And they're not they're not trying to elicit you to get health insurance. They're not a private corporation trying to do this. It's trying to give you unbiased information about how you can get that aid, that like Medicare, that you need, and help you figure out which plan works best for you. So I think that's a really good resource. And it's free, by the way. Both of these are free. So there's no cost to these. So they're just really great resources for y'all to help check in and see where your health, health and insurance and status is, and gives you a good idea of where you are. And then, yeah, for the next ones, We have the low income home energy assistance program. So these people help with energy costs. And basically it works through a grant. And it's been around for a while. But recently they've expanded to they call it LIHEAP Cares. And this is their like coronavirus aid, and they've added $900 million worth of funding. So it'll help people like with energy bills, energy crises, energy related home repairs. And you can only access it once. It starts at July 1st, so it's now active. And it's intended for people who haven't used the aid before during this year. But it helps with annual heating or cooling costs, and it'll be open to all households beginning August 1st. So definitely something to keep in mind. And then Katie, I think you skipped one slide ahead of that because I had two more, I believe.
Oh, I'm sorry about that.
No, you're fine. I was like, wait a second. No, you're good. So other things like on the lines of like utilities and stuff is the Public Utilities Water Business Office. So I think water is pretty vital for everybody right now, especially with like washing your hands and that kind of thing. So I wanted to include this to make sure that people know about what the status is with our water office in particular in Athens. So water shutoffs are permanently on hold, not permanently, indefinitely on hold. Actually will be extended until August 31st. Sorry. And so if you haven't paid or if you're behind within 60 days, they'll keep it on for you, just as long as you try to get those payments back in. And the office is open, but they are requiring you to wear a mask if you decide to go in there. But again, I've put their phone number at the bottom if you have any questions. But everyone should be having water, which is a great news to hear, unless you extended that 60-day period. But even then, I think if you call, you can appeal to that. And then the next source is the ARC. And so basically they help residents of the Athens community get back on their feet after an unexpected job loss, which I think COVID-19 would be considered that. And so they offer a ton of resources, and I've listed them all here, but I'll go through a few of them that I thought would be really helpful. So like the assistant with rent or mortgage, and like assistance with the utility bills such as electricity, gas, or even water, budget counseling, emergency prescriptions I thought was really important. Same with food bank referrals. And then they are doing transportation assistance. And for some of the things listed below, so like for out-of-town medical treatment, bus tickets for food bank recipients, to get gas to and from work, and then apparently also cancer treatment at the RMC. So they're also a really good resource to reach out to during this time. Yeah.
All right. Before we get into we want to do a little bit of a reflection just on our experiences as interns so far with ACCA, but we're going to jump back to the health resources available since it doesn't look like Jack, unfortunately, is not going to be able to join us. He is still making some Meals on Wheels deliveries, which is awesome. So we're just going to go ahead and hop right into this. Specifically, we wanted to talk about COVID-19 testing at the moment, since this is obviously the most prevalent issue at the forefront of our minds. It's kind of a confusing process at times to do or find somewhere to be tested for COVID-19, since a lot of it is getting on the testing center websites and waiting for appointments to pop up, since a lot of them are filled super quickly. So here are some of the places that are offering COVID-19 tests that you can make appointments through the phone number, which is fantastic because a lot of them have been online, and it's a little confusing. So first we have the Athens Health Department, and this offers free testing. I don't know if it's free. I believe it's free regardless of insurance, which is fantastic. And as you can see, appointments can be made at that phone number that has been listed. So feel free to write any of these down. Again, we're recording this, So it will be available later if you need to look back at it for reference. Also, we have the Athens free mobile clinic. That is fantastic and can come to your house. So if you do have transportation issues or you can't find anybody to take you, they'll come to you, which is a really awesome resource, especially right now for a lot of people who don't want to leave their houses, which is very much understandable. And again, that phone number right there, appointments can be made. So please, write down those numbers if you want them. And then the next thing we wanted to touch on are other health delivery resources. So we have pharmacies that are delivering for these essential prescriptions that really you can't go without as they're vital to your health. So we have CVS, Walgreens, Add Drug is also doing curbside as well as delivery. And then Horton's Pharmacy, which is downtown, again, doing curbside if you call ahead, which is fantastic. And then the one ACCA resource that we really wanted to emphasize in relation to health resources is the transportation service. We are still doing transportation services to and from doctor's appointments, which is very important right now as a lot of people, again, do not have transportation right now or scared to get out on their own. So transportation through ACCA is available because we want all of our clients to maintain their regular health appointments to stay healthy despite the fact that COVID-19 is on the forefront of our minds. So yeah, if y'all have any questions about that, please feel free to reach out to any one of us and we're happy to help you out and try and coordinate that. All right, so we're gonna skip back to our reflections. And again, Jack would have gone first, but just a little about Jack. He is doing Meals on Wheels. He also has graduated from UGA with me and Cameron with a degree in health promotion. And I believe he will be beginning pharmacy school in the fall. That's correct, Cameron, right? Okay, just want to make sure that I had all those facts right. And then I've been working with Alan and Nikayla in the Center for Active Living. I also graduated from UGA with a health promotion degree, and I will be beginning my Master's of Nursing in Augusta, actually in August. So that's what I have looking forward to. But just my thoughts on this summer. I have loved getting to know clients, and despite the fact it's all been on the phone, it's been a great experience. And to see ACCA doing the amazing things that they're doing for that older adult community in Athens and the surrounding areas has been really inspiring to me. So I have really enjoyed every second. I wish that I had a longer time here, but Alan and Nikayla have taught me so much. And also, just talking with clients, it's taught me a lot. Just having conversations about life, just little things that make me smile, and I hope they make them smile as well. It's been a great experience, and it's really impacted me. I think it might honestly impact the route that I take in nursing, just depending on what populations I want to serve and what routes I want to go with nursing. So yeah, ACCA has been fantastic.
Yeah, and I can say the same thing. So I also graduated Georgia with a health promotion degree, and I'm also going to Augusta's nursing school, but I'm going for the bachelor's program for their 2-year program. But anyway, so I've been doing work with the Grandparents Raising Grandchildren program, and that's really hit home for me because I was actually raised by my grandparents from the time I was in the 7th grade until now. And so anyway, it's been really cool to listen to, I join in their support group meetings and I call them weekly and invite them and ask them if they need anything and check in to make sure they're all right. And I try to point them to some resources as well. So a lot of these I've kind of seen before. And if they need it, those grandkids run them dry, especially the ones who have younger ones. But anyway, it's been really awesome to hear be on the other side of the conversation, because as a grandchild, you always talk to your grandparents and you think you're in the know of what's going on and how they feel, and if you feel like you're in touch with them. But it's also nice to like see the actual other uncensored perspective from the grandparents, about what their struggles are and what they're going through. And like it's been a really rewarding experience for me personally, and it's fun to see those personalities. Like I find my grandparents to be fun and energetic, and it's cool to see that other grandparents are like that as well. And they're quick and witty, and they're also really quick to provide other resources for other grandparents, and like just like they're willing to share like and be open with their experiences. And I think that's just so awesome, and so admirable, because I think during any time it's really hard to be vulnerable. And I think that I will take this with me for sure, and just one with my relationship with my own grandparents, and trying to provide a transparency that or like open a transparency and a line of communication where it's beneficial to both parties. And I think it'll also again like help me in nursing school as well, and just learning how communication is just so important among the community and among just interpersonal relationships. Like I think and also like everyone's just so sweet, and it's been just a really really rewarding experience for me, I can say.
Awesome. Yeah, thank you so much for sharing as well. And again, I really wish that Jack was here to share with us, but he is doing his thing with Meals on Wheels, which is awesome. But that's kind of all we have for y'all. I wanted to open up the floor for questions. If anybody has any questions regarding resources, us as interns, what our experiences have been. Honestly, I would like to hear any questions that anybody has. So yeah, I'll open that up.
I'll start by saying thank you so much for this great presentation. Well done. And I'm so glad this experience has touched your lives and may influence your futures. I mean, we feel the same way as staff. You know, this is such gratifying, important work, and we love these connections with our community. And you know, this presentation has really helped me remember how special ACCA is in our community. You know, how much we offer within one agency, but then how deep it goes in our community as well. And then when we join forces, great things happen. So thanks for highlighting the work we're doing, but also the connections we have in the community, and the good work that's going on out there during this challenging time. And yeah, that was wonderful. Yeah, if anybody has anything they'd like to add, or any comments or you've observed during this time. I know we just had Josh and Megan join. Hello. Yeah.
I'd like to say kudos to all of our interns. I know it's been a different kind of year. You all have, you know, your unique class, you know, and dealing with all this. So, you know, you're going down in history as, you know, the first class has ever had to deal with the pandemic or doing almost everything virtually. So I just want to commend you all for staying positive and still doing what you need to do to, you know, complete your schooling and your internship and everything. And so I've been really impressed with your class, and thank you for all of your hard work that you've done for us this summer.
Of course. And
Yeah, thank you so much.
that means a lot coming from y'all.
Yeah.
All right. Okay. Well,
Thank you.
well, I guess if no one else has anything to add, I guess we'll wrap up. Again, thank y'all so much for joining. I love that y'all showed up and wanted to hear, and so we really, really appreciate it.
Yes. Thank you all for joining.
Mm-hmm.
Okay.